community conversation, we are joined by Dr. Winston Wu, emergency medicine physician with UVA Health. He's sitting down with Aaron.
Dr. Wu, thanks for coming in today.
Yeah, of course.
All right, so today we're talking about the norovirus. So what exactly is that, and how frequently are you guys seeing cases this winter?
Yeah, so norovirus is essentially the most common cause of something that we call viral gastroenteritis, which is essentially a really big way of saying a virus that causes an infection in the gastrointestinal tract that leads to kind of the common symptoms of nausea, vomiting, and diarrhea. At UVA, we see about 15% of our patients come in with a chief complaint of abdominal pain, most commonly being what we end up diagnosing as viral gastroenteritis, and especially over the last month or so, it's basically skyrocketed. I would say almost like 1 in 4, 1 in 5 patients come up with something that seems to be caused by something like norovirus.
Oh wow, so that's very common this time of year.
Exactly, especially during the winter.
Okay, gotcha. And what are the most common symptoms?
Yeah. So the syndrome that we kind of link to norovirus is the most common thing you're going to get is nausea with pretty profound vomiting. And then if you have a more serious disease, then that's when you can start having the kind of profound amounts of diarrhea, which obviously is very uncomfortable for everybody. Yeah. Nobody wants that. And then you can also get things like diffuse abdominal cramping. Sometimes you can have fevers, but really the most common symptom is the vomiting.
Okay. And what can someone do to reduce their risk for norovirus?
So it's the simplest answer is to wash your hands. This is something that is really transmitted by contact. Unfortunately, things like hand sanitizer don't actually work. If you do think you were in contact with someone who's sick, if there were some bodily fluids, then really you do need to be washing your hands with soap and water. Norovirus is also something that's very a foodborne illness as well, whether that be the person who's prepping the food or it could be coming from the food itself, like fruits and vegetables. In that case, you really have to be aggressively kind of washing the food that you're preparing and making sure everything is sanitary and clean as well.
Okay, so hygiene is pretty important.
Most important thing.
Yeah. Gotcha. And so what treatments are available for norovirus?
So really the mainstay is what we call supportive care or just aggressive hydration. Essentially the goal is to really replace any of the fluids that you lost. That can be with something as simple as water. There are oral rehydration solutions out there kind of with electrolytes that you can mix with water. They taste a little bit better. I think the main thing though is that we want to stay away from things like sugary sports drinks. Like I love them, they taste great.
Yeah.
But ultimately they end up kind of dehydrating you more just with the sugar content in them. So really is hydration, hydration, hydration.
Okay, and water is the best option?
Probably. Yes.
Okay, gotcha. All right, well those are all really good tips. Is there anything else that you want to add about the virus itself or how people can get in contact with you all?
Well, we're always at the UVA emergency department. We're there 24/7. If you're having really bad symptoms and want to get checked out, we can always see you there. And specifically to norovirus, this is a really bad time of year, especially if you have young children, just because they may not be the best at hygiene.
Right.
So just be very careful in terms of kind of making sure they're washing their hands. And then specific populations at risk are the very young and the very old. So those are kind of the types of people when they start having these symptoms you really want to take a closer look at, make sure they're hydrating, and make sure that they're getting through this illness as well as they can.
Right. Okay. Those are some good tips there. Thank you so much, Dr. Wu. We appreciate it.
No problem.
All right, Steve, over to you.